I am 40 years old and I live in Wausau, Wisconsin. When I'm playing my violin, it almost feels like I'm transported to a different place. I just get so into the music and the emotions of the notes, and it's almost therapeutic. Dig your arm into your bow, add more pressure, but then you have to... I teach 6th, 7th, and 8th grade at a middle school. 1, 2, ready, go. That's a little better. It's a wonderful age group, and they're very eager and enthusiastic to learn music. They're so much fun to be around, and I just love being on stage and seeing their energy and making that first note and having that first concert. It's really exhilarating. I know when I lost my vision completely, that was something I wanted to make sure that I was still able to do. My name is Courtney, and I have neuromyelitis optica, otherwise known as NMOSD.
But what that really means is it's an inflammatory brain disorder whereby the immune system is attacking either the optic nerve and making people lose their vision, or attacking the spinal cord, resulting in people having difficulty moving their legs or controlling their bladder or their bowel.
NMOSD is pretty rare. I think in the United States there's estimated 4,000 patients, and throughout the world I think there's 250,000. I think there's probably a lot more that we don't know about that are misdiagnosed or maybe undiagnosed, but still very rare.
I first started experiencing symptoms with my eyes in August of 2009, which was roughly 3 months after we were married. And at that time, we just thought it was an eye problem because that was really the only symptom that I had. It came on really gradual. It was kind of like a blind slowly being pulled down over your eyes, and it would get darker and darker. And it only happened in my left eye at this time. And I went to an eye clinic and they labeled it as optic neuritis and said, this is actually kind of common. And for most people, you just wait and it will come back. So that's what we did.
Many patients with NMOSD are misdiagnosed with multiple sclerosis and initiated on MS drugs, which unfortunately for many can actually make NMOSD worse. Why is NMOSD misdiagnosed as MS? Well, it's quite simple. Firstly, optic neuritis, which is inflammation of the optic nerve, is a common initial symptom in both multiple sclerosis and in NMOSD. Inflammation of the spinal cord, called myelitis, is also commonly seen in both multiple sclerosis and in NMOSD. The difference, however, is that NMOSD patients have an antibody that targets the water channel, so they have a specific biomarker. This is a protein that is made by your immune cells in the blood. And that antibody allowed us to make a definitive diagnosis of this rare disease. So for example, if you have the antibody in your blood, you have the disease. And that really revolutionized our understanding of the disorder NMOSD and allowed us to distinguish it from multiple sclerosis. You never find aquaporin 4 antibodies in patients with multiple sclerosis.
My name is Sumaira. I live in Boston, Massachusetts. I've lived here now for 14 years. Although I don't test positive for the NMO antibody, which is called aquaporin 4, I was ultimately diagnosed with neuromyelitis optica. Based on the symptoms that I experienced and the inflammation that they found in my imaging, they felt that that was the most plausible diagnosis at the time. And 7 years later, that continues to be the diagnosis that we stick with, despite not testing positive for the antibody.
Hold down. That was good. Good.
If they're not positive for AQP4, you would be basing your diagnosis on the MRIs and the clinical findings that you have, which isn't, as nice as having a yes or no definitive marker, but I mean, you can make that diagnosis.
I was told that my vision would be restored within 3 months to a year, just kind of move on with my life. So that's exactly what I did, or what I tried to do. Three, 4 weeks after that hospital visit, my vision did not get better. In fact, it got worse. On top of that, I experienced severe nausea, pain in the back of my neck, numbness and tingling in my hands and feet, and to the point where I felt completely debilitated. The first 18 months of my illness were probably the most harrowing of days. It was like I was living a nightmare every day in my own body. Physically, things were so different. I literally could not see. I couldn't touch things without my hands feeling like they were on fire. As a former dancer, I had trouble walking without feeling pain or not feeling anything at all sometimes. On top of that, you're just trying to wrap your head around the fact that you went from being perfectly healthy and feeling like you're on top of the world to losing everything and all at the same time. And no one around you knows how to treat this, how to help you, how to stop this from taking over to the point where maybe you might die someday.
When my vision wasn't coming back, we did get a referral to go to Mayo in November, so that would have been 2 or 3 months later after my vision was completely gone in my left eye. I went to Mayo November 2009, and I underwent neurological tests. That was quite extensive. I saw an ophthalmologist there. They had me do a blood test, and that was what actually diagnosed me with NMO, and it showed that I had the antibody for NMOSD.
It's extremely important to make the diagnosis of NMOSD early. Patients with NMOSD, if they're not treated, have a very severe disability outcome. In the pre-treatment era, where we didn't really know what to do with patients or how to treat patients, or where patients were very much delayed in getting therapy, and about 30% of patients died within 5 years from respiratory failure because of involvement of the upper cervical cord.
I remember reading life expectancy was 5 years, and I was more in shock. I was thinking that I would never see again, that my life is gonna be completely turned upside down. I got married in June, and then by August and November, I was diagnosed with this, and it just kind of felt like it came out of nowhere. Being completely healthy one day, and then having this terrifying disease that I'll have to maneuver through life with. It was pretty terrifying.
When Courtney got diagnosed with NMOSD, honestly, I felt a little bit of relief because now there was a name to it. It was a very rare disease and not well known at the time. To me, it just actually gave me a little bit of comfort because we knew something was wrong. And now knowing what was wrong with Courtney gave me hope that there could be more positives coming out in the future.
While they had given me a diagnosis, because I didn't test positive for the antibody, they wanted to keep testing for other things to ensure that they didn't miss a beat. And I think the most impactful of them was when my doctor said to me, he said, you know, Sumaira, you may have cancer. I went in for the PET CT scan, and I was told that 24 hours later, I would get a call with the results. Longest 24 hours of my life. I received that call, and the doctor told me that I didn't have cancer. And under normal circumstances, I think anybody would be elated to hear that. That's great news. But I was heartbroken. I was devastated beyond words. I was disappointed that I didn't have cancer. Because I knew that this was so much worse. I had gotten to a point in my situation where getting cancer would have been good news, and I was sad to not have had it. That was my situation. That was a tough time.
In February, I was conducting on stage with my 6th graders, and I noticed that my vision was getting worse in my right eye while I was on stage. And at that time, I know I was panicking, but I also knew I had to finish this concert. I couldn't just leave my students up there. And so I finished the concert and called my doctor, and they said, come in the next day. And when I woke up that next morning, I had no vision in my right eye either. So I could see absolutely nothing.
With NMOSD, we as doctors can have a huge impact in trying to help patients avoid the development of blindness or paraplegia.
I'm 27 years young. I actually live here in Cartersville, Georgia. My name is Deshon, and I have NMOSD. My hands were numb. For example, if I wanted to write something, if I wanted to just, make a drawing or just write my name, write signatures, that's when my handwriting was sloppier. Like my hands just, it wouldn't work with me. That's when I've noticed that I was walking, not a little bit, a lot stiff, to where it was hard for me to just go to the restroom, go to the bathroom. It was to where I had to use my mother's walker. I couldn't even just specifically get up off my bed. Not a lot of people actually understand just how bad that made me feel.
You don't have a 27-year-old healthy guy with no other, medical problems that starts having difficulty walking. And I think his symptoms actually started in December. I didn't see him until February. When he came that day to the visit, he really should have been in a wheelchair. He really shouldn't have been walking. He was unable to control his bowels or his bladder, and he couldn't see. His memory and his cognition was way off. What started with what he explains is just a numbness or a weird feeling in his legs to end up having all those other symptoms and all those other, not systems, but all those other effects on different parts of his body, the vision, the bladder, the bowel, the spasticity, the cognition, the memory. It was extraordinary.
Thinking about this disease when a patient walks in with painful blurring of vision, when a patient walks in with a transverse myelitis and they have weak or numb legs, we must have this in our differential diagnosis.
Right from the jump, she knew just what I was going through.
He went from a healthy 27-year-old to being completely debilitated.
It was just a tough road, a tough situation. The pain was very, very deep to where it just hurt me not only physically, but emotionally as well. I felt very, very defeated.
If you do that antibody test and it's positive, you have made a diagnosis for that patient that will result initially in significant stress for the patient, but long-term will allow us to get early treatment.
Lucky for Deshon, it was, he did have a positive AQP4 antibody, which allowed us to make a definitive diagnosis of NMO, and then the race was on to get him on treatment.
So when we talk about the treatment of patients with NMOSD, I think we need to think about two things. The first thing is, how do we treat the acute attack? That acute attack of inflammation of the optic nerve, or that acute attack of inflammation of the spinal cord. The second important approach to treatment of NMOSD is really help that patient live as normal a life as possible. So I think we've made great headway in terms of moving NMOSD from a disorder that kind of fell within the MS spectrum to a disease that has its own defined immunopathology. It's a distinct entity. It now has its own kind of treatment regimen. So the discovery of that biomarker allowed us to rapidly move towards understanding mechanism, towards identifying target, to a point where we are at a much different place than we were 20 years ago when I started working on this disease. Remember, these attacks that patients with NMOSD have are very severe. They can be very disabling. So we're in a much, much better place. We're in a very, very exciting place for patients.
So all of this white that's showing up here, that's all abnormal. I am not too proud to beg, and so I reach out to everyone that I know to really treat his symptoms. He needed to get on a treatment for NMO, and we did that.
I know the story from the beginning with Deshon, the effort she put in, the number of people she brought into the circle.
I had a patient who has a social network of friends who were looking to make a donation or looking to do something special. Wanted to know if we had a patient who maybe needed some help, and it was at the exact time when this was going on with Deshon.
Good to see you in person again.
Good to see you too. God bless y'all. God bless.
So, and I think they have become a support system for him to this day.
Stacey, always just so willing to just help someone in need.
Connecting his medical care, his financial needs, his emotional needs, his support and cheerleading needs.
It's just, yeah, like you said, yes, it's a tough difference. I'm very appreciated, and there's just a lot of just beautiful, sweet lives out there that really cares a lot about me and cares about how I feel. And that's just something that I'm always gonna think about for the rest of my life. It gives me confidence to just get me back on my feet.
It's remarkable, and it's refreshing, I think, in today's society to see so many people who care about this young man who could have been completely disabled.
We're blessed to be part of the journey.
My husband, Jake, was my biggest supporter. I wouldn't have gotten through this without him. He has a very positive outlook, positive attitude, and He kept that going, which helped me stay more positive.
Step. Step.
I would definitely say that having NMO has made my son a more compassionate person. With my visual impairment, even as a toddler, he would know how to lead me around or how to tap on a step. It's pretty amazing how wonderful and compassionate he is. Playing music with Caleb is the best thing ever. To have that special bond with your son. And now he's at that point where he can play cello and violin duets with me, and it's such a unique and special thing that we have between us.
The story of NMOSD is a story that can teach us all about rare diseases. It's a story that started with biomarker discovery, led to understanding mechanism, and led to novel therapies. The way in which that happened is really a prime example of how neurologists and scientists and patients with an interest and a passion for NMOSD have come together. That coming together has been driven by a variety of different foundations, like the Guthrie-Jackson Charitable Foundation. It's been driven by industry, and it's also been very much driven by international collaboration. The way that the international physician scientist community have come together around NMOSD is just so fulfilling to see how we've taken a disease that was devastating and moved it to something that we now understand and something for which we now have great treatments.
Two months after I got diagnosed with NMO, I decided to start a foundation, something I had never done before. So my life's work and my life's mission from that point forward became to raise awareness, to fund research. In July, the foundation was excited to celebrate 7 years of the Sumaira Foundation.
Thank you for being here, seeing so many faces after so long.
It was a beautiful night of people coming together for the sake of this cause that I've dedicated my life to. I knew firsthand and understood that community and connectivity with other patients, other people who had similar and shared experiences. There was an invaluable price to that.
We have to continue to focus on education. We have to continue to focus on early diagnosis, correct diagnosis, and initiation of appropriate therapy.
I'm grateful. I know that there is research and there have been newer medications that are coming out, which is wonderful, but there still isn't a cure.
It just really makes me want to just work harder, not only physically, but mentally. I'm a very huge, strong believer on just talking about, what somebody's been through. I can be a huge inspiration for a lot of people out here.
And I think the more work that we do together, the more effective we'll be. So I am very hopeful. We might find a cure in my lifetime. That's my goal.